Electrocardiograms, or EKGs, are essential tools in modern medicine. They help medical professionals assess the heart's electrical activity. This is crucial for diagnosing various heart conditions. For nurses, mastering EKGs is vital for patient care. Understanding EKGs can improve patient outcomes. They allow for early detection of issues. Quick and accurate readings can save lives. Thus, nurses must be proficient in using and interpreting EKGs. EKGs are non-invasive and straightforward. They provide real-time data about the heart. This makes them indispensable in both emergency and routine care settings. Nurses, therefore, need to be skilled at reading and understanding these charts. Proper EKG interpretation is a critical skill. It requires practice and knowledge. This guide aims to help nurses understand EKGs better. By the end, you should feel more confident in using this vital tool. An EKG is a test that measures the electrical activity of the heart. It records the timing and strength of electrical signals as they travel through the heart. This information is captured on graph paper or a digital screen. The heart's electrical activity is crucial. It controls the heart's rhythm and rate. EKGs can show if the heart is beating too fast, too slow, or irregularly. They can also reveal if parts of the heart are overworked or damaged. The test is quick and painless. Small electrodes are placed on the skin. These detect the electrical signals. The results can be read immediately, providing instant insights into the heart's condition. EKGs are commonly used in various healthcare settings. They are essential in emergency rooms, during surgeries, and in routine checkups. This test helps in diagnosing heart attacks, arrhythmias, and other heart-related issues. The heart is a muscular organ that pumps blood throughout the body. It has 4 chambers, 2 atria on top and 2 ventricles below. Blood flows through these chambers, driven by the heart's contractions. The right atrium receives oxygen-poor blood from the body. It sends it to the right ventricle, which pumps it to the lungs. Here the blood picks up oxygen and releases carbon dioxide. The oxygen-rich blood then returns to the left atrium. From the left atrium, blood moves to the left ventricle. This chamber pumps it out to the rest of the body. The heart's pumping action is controlled by a series of electrical impulses. These impulses ensure that the heart beats in a coordinated manner. The heart also has valves that prevent backflow of blood. They ensure that blood flows in the right direction. Any issues with these valves can affect the heart's efficiency and show up on an EKG. The heart's electrical conduction system controls its rhythm. It starts with the sinoatrial SA node located in the right atrium. The SA node is the natural pacemaker of the heart. It generates electrical impulses that cause the heart to beat. These impulses travel through the atria, causing them to contract. The signal then reaches the atrioventricular AV node. Here the impulse is delayed slightly. This allows the ventricles to fill with blood before they contract. From the AV node, the impulse travels through the bundle of His. This pathway splits into right and left bundle branches. These branches carry the impulse to the ventricles. The ventricles then contract, pumping blood out of the heart. The coordinated contraction and relaxation of the heart's chambers are vital. Disruptions in this electrical pathway can cause arrhythmias. These can often be detected through EKG readings. Understanding the electrical conduction system is crucial. It helps in interpreting EKG results accurately. This knowledge allows nurses to identify abnormalities in heart rhythm and function. Section 5. Steps for placing EKG leads. Proper placement of EKG leads is essential for accurate readings. There are 10 electrodes used in a standard 12-lead EKG. These include 4 limb leads and 6 chest leads. Correct placement ensures the signals are captured accurately. Start with the limb leads. Place 1 electrode on each wrist and 1 on each ankle. Ensure the skin is clean and dry. Shaving may be necessary to ensure good contact. The limb leads provide a baseline for the heart's electrical activity. Next, place the chest leads. Start with V1, placed on the 4th intercostal space to the right of the sternum. V2 goes on the 4th intercostal space to the left of the sternum. V3 is placed midway between V2 and V4. V4 goes on the fifth intercostal space at the mid-clavicular line. V5 is placed at the same horizontal level as V4, but at the anterior axillary line, and V6 is at the mid-axillary line. Ensure all leads are securely attached. Poor contact can lead to inaccurate readings. Double-check the placement before starting the EKG. Accurate lead placement is crucial for reliable results. Section 6. Interpreting EKG readings. Interpreting EKG readings requires practice and knowledge. The EKG strip shows the heart's electrical activity as waves. Each wave represents a different part of the heart's cycle. The main components are the P wave, QRS complex, and T wave. The P wave represents the atrial contraction. It should be small and positive. The QRS complex follows and represents ventricular contraction. It is usually larger and more complex. The T wave represents ventricular relaxation and should be smooth and rounded. Look for abnormalities in these waves. Irregularities can indicate heart issues. For example, a prolonged QRS complex might suggest ventricular hypertrophy. An inverted T wave could indicate ischemia or infarction. Also, consider the heart rate and rhythm. A normal heart rate is between 60 and 100 beats per minute. Any deviations from this range could indicate arrhythmias. Consistent practice will improve your ability to interpret these readings accurately. Section 7. Common heart conditions diagnosed by EKG. EKGs are instrumental in diagnosing various heart conditions. One common use is detecting arrhythmias. These are irregular heartbeats that can be too fast, too slow, or erratic. EKGs can pinpoint the type and severity of the arrhythmia. Heart attacks are another critical condition diagnosed with EKGs. Changes in the EKG pattern can indicate a heart attack. For example, an elevated ST segment can suggest an ongoing heart attack. This allows for immediate intervention. EKGs can also identify conditions like heart block. This occurs when the electrical signals are delayed or blocked as they travel through the heart. Depending on the degree of blockage, this can be a serious condition requiring treatment. Hypertrophy, or thickening of the heart muscle, is another condition seen on EKGs. This can be due to high blood pressure or heart valve disease. EKGs help in identifying these changes early, allowing for timely management. Section 8. EKGs in emergency situations. In emergency situations, EKGs are lifesavers. They provide quick insights into the heart's condition. This is crucial for patients experiencing chest pain, shortness of breath, or fainting. EKGs can help determine the cause of these symptoms rapidly. For patients suspected of having a heart attack, an immediate EKG is essential. It can confirm the diagnosis and guide treatment. Time is critical in these situations. Quick EKG readings can lead to faster interventions, improving patient outcomes. In cases of severe arrhythmias, EKGs help in deciding the course of action. Some arrhythmias require immediate treatment. EKGs provide the necessary information to make these decisions. This underscores the importance of EKG proficiency in emergency care. Emergency medical teams rely on EKGs. They are part of the standard protocol for assessing heart-related emergencies. Nurses must be adept at using EKGs under pressure. This can make a significant difference in patient survival and recovery. Section 9. Training and practice for EKG proficiency. Becoming proficient in EKG use requires training and practice. Nurses should undergo formal training programs. These programs cover the fundamentals of EKGs, from lead placement to interpretation. Hands-on practice is crucial. Use simulation tools and real-life practice to hone your skills. Regularly reviewing EKG strips can improve interpretation skills. Familiarize yourself with normal and abnormal patterns. Continuing education is also important. Stay updated with the latest guidelines and techniques. Attend workshops and seminars. Networking with other professionals can provide valuable insights and tips. Proficiency in EKGs enhances patient care. It allows for quick, accurate diagnoses and interventions. Investing time in mastering this skill is beneficial for any healthcare professional. Section 10. Conclusion: the role of EKGs in patient care. EKGs are pivotal in assessing heart health. They provide critical information about the heart's electrical activity. For nurses, mastering EKGs is essential for delivering quality patient care. Understanding how to place leads correctly ensures accurate readings. Interpreting these readings correctly can diagnose a range of heart conditions. This allows for timely and appropriate interventions. In emergency situations, EKGs are invaluable. They guide immediate care decisions that can save lives. Regular training and practice are necessary to maintain proficiency. In conclusion, EKGs are a vital tool in healthcare. Nurses who are skilled in using and interpreting EKGs are better equipped to provide excellent patient care. This not only improves patient outcomes, but also enhances the overall quality of healthcare services.